The disease that I had was multiple sclerosis. Multiple sclerosis occurs when a person's immune system attacks a fatty material called myelin. Myelin is the wrapping around our nerve fibers, and without it, our nerves become damaged. This damage can cause the signals being sent from your brain not to send correctly. Multiple sclerosis affects the brain, spinal cord, and optic nerves. It affects a person's vision, balance, muscle control, and other basic body functions. There are different degrees of MS, ranging from mild to severe. Some people with severe symptoms may have trouble doing even the simplest daily tasks. The etiology of MS is unknown, although there are many things that seem to increase the likelihood of a person to develop MS. Smoking and certain genes may increase a person's risks. Certain viruses, like the Epstein-Barr, may increase the likelihood of developing it because it affects a person's immune system. Multiple sclerosis seems to be an autoimmune disease in which the body attacks its own tissues. There seem to be environmental factors that may affect a person's chance of developing multiple sclerosis. Evidence shows that vitamin D plays a role. People who live closer to the equator seem to have a lower tendency of developing MS. More and more evidence is suggesting that smoking plays an important role in multiple sclerosis. Some studies show that smoking increases a person's risk of developing multiple sclerosis and is associated with more severe disease and more rapid disease progression. Stopping smoking can help slow progression, studies show as well. Multiple sclerosis is not hereditary, but having a first-degree relative, such as a parent or sibling, with multiple sclerosis does significantly increase an individual's risk of developing the disease. Parts of the body affected by MS. The nervous system is one of the organ systems that is affected by multiple sclerosis because it causes the nerves to get damaged and have problems sending signals to the rest of the body. Also, the respiratory system can be affected by multiple sclerosis. If the muscles in the chest weaken too much, breathing can be difficult for a person with MS. The eyes are another part of the body that is affected by multiple sclerosis. Vision problems are one of the first signs that something is off for people with MS. They may get blurry vision or double vision, for example. Nerve tissue is also affected by MS. Because it is an autoimmune disease, the body attacks its own healthy nerve tissue, which can cause other problems for a person suffering from multiple sclerosis. The bladder is another organ that is affected by MS. 8 of 10 people with MS suffer from bladder problems. The nerve damage can affect how much urine the bladder of a person with multiple sclerosis can hold. There are so many other parts of the body that multiple sclerosis affects because in reality, it affects most of the body because it damages the nerve signals sent throughout your entire body. Signs and symptoms of MS. Numbness or weakness in one or more limbs, vision loss, double or blurry vision, unsteadiness, slurred speech, fatigue, dizziness, and problems with bowel and bladder function. Treatment. There are no treatment options, but there are some treatment options, but there is no cure. The treatments that are out there are used to do a few different things, including minimizing symptoms, slowing the progression of the disease, and lowering the number of attacks. Multiple sclerosis can be a very difficult disease to deal with for people when they get diagnosed with it. They don't know just how fast their disease will progress, and if it progresses quickly, they can lose the ability to do simple everyday tasks that they were able to do before. People with multiple sclerosis can lead a fairly normal life. My aunt was diagnosed with MS when she was in her 20s. She is now 54 and still works, takes care of her family, and does normal things that the rest of us do. Though recently her MS has started progressing a little bit more rapidly because things like falling and such are happening more frequently with her. Hopefully someday scientists and doctors can figure out the etiology of multiple sclerosis and help to prevent it from happening to more people. Some treatment options for people with MS are physical therapy, muscle relaxants, medications to reduce fatigue, pain, depression, bowel bladder control problems, medications to slow the progression of the disease, and plasma exchange. Beta interferons are some of the medications that are used to help treat MS. Beta interferons are injected into the skin and help to reduce the frequency and severity of relapses. Some examples of beta interferons are dimethyl fumarate, mitoxantrone. Some side effects of those drugs are flu-like symptoms and injection site reactions. Glutaramer acetate helps to block your immune system's attack on myelin. This medication is also injected, so it can have injection site reactions as well. Dimethyl fumarate helps to reduce relapses. Some side effects include flushing, diarrhea, nausea, and lowered white blood cell count. Fingolimod is used to reduce relapse rate as well. It can cause hypertension and blurred vision. Teriflunomide is used to reduce relapse rate. This drug can cause severe limb damage, hair loss, and other side effects. It can also be harmful to a developing fetus. Natalizumab is designed to block the movement of potentially damaging immune cells from your bloodstream to your brain and spinal cord. This drug can cause a viral infection of the brain called progressive multifocal leukoencephalopathy. Natalizumab is used to treat those who have more severe or more active multiple sclerosis. Mitoxantrone is an immunosuppressant. Some side effects of it include heart damage and the development of blood cancers. Mitoxantrone is used to treat severe cases of MS. There are only a couple treatments for the attacks of multiple sclerosis. Corticosteroids are one. These drugs are prescribed to reduce nerve inflammation. Side effects include insomnia, increased blood pressure, mood swings, and fluid retention. The most common corticosteroid is prednisone. The other treatment for the attack of multiple sclerosis is plasma exchange. The liquid portion of the blood called the plasma is taken out and separated from the blood cells. These blood cells are then mixed with a protein solution called albumin and put back into the body. Plasma exchange is used if a person's symptoms are severe and they don't respond to steroids.